Well, good morning, everyone. It is 9:02 on October 18th, Monday. Thank you guys very much for being here. And I know it is already open enrollment for those of you that are doing Medicare. I hope you guys had a fantastic first day on Friday. I know some of you have been working throughout the weekend, and we do appreciate all the hard work that you guys are doing. It will pay off, I promise you. There's a lot of business and there's a lot of folks that need your help. So as a reminder why we're here, other than to earn a paycheck and a commission, we are here to improve the lives of our community with affordable healthcare. So thank you for taking on that mission, and thank you for helping our community get better and healthier. So as we normally start, I'm going to go ahead and open up the training here. Those of you that are joining by phone, just know that we do have a video capability now. So we do recommend that you join us by computer for the next call, because I am going to start showing visuals, and that way you guys can see what's going on out there in the world. And today, for instance, I'm going to be sharing with you the HPM Shop and a couple of things on there. So that's why it's pretty important that you join by computer. But we understand if you're on the road and you can't be eyes on, we appreciate that you're being on the call anyway. So with that said, training calendar, just as a quick run through on the training calendar, we're going to keep the calls on Monday mornings at 9. For those of you that are happy to join, just know that if you have a client or an appointment, we are recording these now, so you can always come back to it, and you can find the recording on our main website at joinhpm.com. Just scroll down to the bottom. This morning, Devoted's going to be doing their coffee and chat session at 11. You can jump on there. It's geared toward the Orlando market, but you can go ahead and jump on there for any Devoted questions. Also an open training on Tuesday, tomorrow at 11 as well. So again, any questions, concerns, anything that you might need help with Devoted, they are all hands on deck. We really like this. And also every morning at 8 o'clock, if you look on the training calendar, there's a link that Tom had put in there for our YouTube channel, where it walks you through the full demonstration for HPM Shop 2022. So please make sure that you know what's going on with that if you haven't yet watched that full video. I know many of you are using HPM Shop. One thing that I did do on the training here is cut it up into chapters. So you can actually log in, or when you're watching the video, you can go to the actual section that you're looking for in the training. So if you're wanting to look, how do I look up a provider, or how do I connect to mymedicare.gov, you can jump to that chapter. So it's a great reference point. I'm going to show you a couple things on HPM Shop today as well. Thursday, the 21st at 9 o'clock, we've got the weekly question and answer session with Tom Ryan. So thank you very much for that. If you have any questions on anything in the business, Tom's going to be available on Thursdays at 9. Just an open chat session there to help you, navigate the world of insurance. So again, he's there Thursdays at 9, open forum. Any questions that you might have, even if you need a little bit of training, he's there to help you on that. Also, Thursday, the 21st, Devoted's doing a coffee and chat session for the Jacksonville area at 11:30. Again, just question and answer there. 1 o'clock, Aetna's doing an ACA training on Thursday as well. You can register for that. Also at Thursday, 2 o'clock, we are doing a training working with providers. Jump on there if you need a little bit of TLC and learning about how to work with your providers this season. And then last training for the week is WellCare's rollout session. And as you know, WellCare has rebranded. All of the Centene products are now going to be called WellCare, with the exception of Ascension Complete, which is in the Jacksonville market. That'll stay Ascension Complete. But everything else, Allwell, HealthNet, Fidelis Care, all of those brands are now going to be rolled up into WellCare. So they are all rebranding as WellCare. So Allwell will eventually go away, although there are some products out there still called Allwell. But they are doing their virtual rollout session on Thursday at 3 o'clock. If you are interested in jumping in that, you can go ahead and jump in that. So that is the training for the week. As I always say, keep one foot in the classroom and the other one in the field at all times. Okay. Now, big news with providers. I will say that there are many providers now, and this is happening not just in the Orlando market, but across the country now, thanks to CenterWell. And CenterWell has now rolled out a brand new program, and I sent you guys an email. Business owners, I will send you out an email separately as well, just to kind of tailor what's going on with this particular program. But CenterWell is now offering what they call a care coordination fee or an administration fee for any agent that chooses, or their client chooses CenterWell for the first time, and then they go ahead and you as the agent call in and set the appointment and schedule the appointment for that new member. And as you're doing that, there's a dedicated phone line. I have full instructions. There's a training that you must go through in order to participate in this particular training. So please check your emails. Some of you got a text message. I apologize. It was supposed to go out at noon. It went out at midnight. So if you did get that text, I do apologize. But in either case, you got that text message and email. Go ahead and watch that training, and there's more instructions in there. Bottom line is if you have a client that is interested in enrolling in CenterWell, and you as the agent call in and connect them with CenterWell and get that appointment on the books, they will be compensating you, depending on your market, either $100, $150, or $200 in the Orlando market. Okay. So for more information on that program, please check your email. Please check your text messages, and there'll be a link in there with the training, so you can watch that training and get up to date on how you can earn an extra $200 for putting them with a great doctor group anyway. Okay. All you need to do is just help them set that first appointment, and then you're done. So very, very simple, nothing heavy lifting on that, but the providers are compensating you as the agent to get that done. Okay. We do know that there are other provider groups that are going to roll out similar programs, and as they become available, just so you know, Nick, myself, Sergio, we always vet these programs and just make sure that we understand how all of the nuts and bolts are working with these programs before we launch them. So if you hear something on the street, if you have a question about it, let us know. Most likely we've heard about it too, but either we've chosen not to participate with that particular group, or we need to do some more research. So CenterWell was the first one out of the gate that was most competitive, and so that seemed to be a really good thing to help you guys out, earn some extra cash. But also, really, it's all about coordinating that care with your client to their first provider group. So more to come on that as we move forward. So next thing, CMS last week released a new memo out to the agent community. This is to all agencies and agents, and it's an addendum to the marketing guidelines. And I want to talk about it very briefly here today because it does require action on your part, okay? CMS now says that any and all marketing materials, that includes business cards, flyers, rack cards, anything that is geared specifically to target Medicare beneficiaries, those materials must be submitted to CMS for approval, okay? That includes websites as well, stickers, banners, anything that specifically calls out to Medicare beneficiaries must be submitted for approval through CMS. Now, for the time being, if you have any marketing materials that need to be submitted, you all should have our email. Please email us, and we will connect you on how we can get your supplies, your marketing materials loaded into the system. So it just has to be a design. If you use a flyer, if one of your main things as a postcard that you use, please send us a copy of that postcard and we will get it uploaded. We will talk specifically to agency owners. So if you are running a team, obviously we're going to talk to you about how you can manage that, because it's not very hard to do. You just have to set up an account. But for the time being right now, this is a somewhat urgent message, because I want to ensure that everybody is compliant on this. Okay. So if you have any marketing materials that you're using, your designs need to be submitted to us so we can submit them through CMS. Now, if you're using Health Plan Markets designs, we are already working on there, so there's no action needed. So if you are using one of our flyers, if you're using our business cards, if you're using the rack cards, just know that we are already submitting those materials, so there's no action needed on your part. If you have your own business cards, your own flyers, your own materials, we need to get those submitted, so that way we can make sure that you stay in compliance. Okay. So again, just shoot us an email, anyone on the team, and we'll forward it over. Sergio is in charge of that, so I'll be working with him on how to coordinate all this and get those supplies up and running and approved for you. So thank you for that attention on that. We all want to stay compliant and we don't want any boo-boos. Okay. Yes, and that does include business cards. I will also say that if you are ordering marketing materials right now, we're happy to help you with some of those of you that are business owners, agency owners. I am rolling out a partner pay program, which I did email out over the weekend, so check your email on that. But those of you that are using HPM business cards and materials, just know that our printing does take, if you order today, approximately 3 weeks to get in your hands. We are looking for other options to speed up that order. But for now, if you placed an order today, it could take up to 3 weeks. Just know that. The reason I'm telling you that is because if you're running low on business cards, flyers, and you already have a design and you just need to re-up on it, take a look at your inventory. We're going to talk about supplies here in just a minute. But please take a look at what you've got and place the orders now. Don't wait until you get all the way to the bottom and you're like, oops, I'm out of business cards, because that's going to take you about, anywhere from 2 to 3 weeks. So just know that it's really, really important that you keep an eye on inventory. Speaking of supplies, as you know, in your trainings with each of the carriers, you are all capable and able to order your own sales materials and your own kits and your own supplies. Now, we will do our best to stock the minimum amounts in our office. There are many, many, many plans this year that have many sub-plans built into them. And it's really important that you know what you need and you stock up directly with the carrier, because although we do have some materials in the office, call ahead, because we may not have that particular plan that you're looking for. And as supplies come in, it is first come, first serve. We do love that you come by the office and pick up kits. We're happy to supply you with what you have. But just know that, if we run out of kits, it's imperative that you know how to order your own kits. Okay. Don't rely on us as the primary source of sales kits. Okay. Know how to get your own kits. Now, I will say that the team has done a phenomenal job organizing and getting kits ready for everyone. Best practice here is call ahead. If you know that you're running low on kits, or you need some WellCare kits or some Bright Health kits or some Devoted kits, Freedom kits, you're going to want to go ahead and call ahead and tell us how many you need before you come into the offices. So that way, number one, we want to make sure that we have it so you don't waste the trip. And then number two, we can set it aside so no one else grabs it between now and that time. So just some best practices. You can email us ahead of time. You can call us, you can text us, whatever it takes. We're glad to get those kits and everything ready for you, because I know you guys are running and gunning. But really, best practices is ensure that you know how to order your kits, and when supplies run low, make sure that you get those things done. We are slowly getting giveaways into the offices. I know many of you have been asking about promo items. Promo items specifically are for events. They are not just to stock up in your car and hand out to everybody. Really, they are for events. So please just use the little tchotchkes and the giveaways for event-based marketing. Or if you're working with provider groups, if you're going in there and handing them out to the staff, that's cool to do too. Please don't stockpile them. Same thing with the kits. Please don't stockpile them, because there's somebody else on the team that could use those items, and it's hard to get to them if they're in your garage, if they're in the back of your car. Okay, so just please take what you need. I know the team is asking you, and it's not to be offensive at all. It's just to make sure that we have kits available for everybody and giveaways away from everybody. But please know that know how to order your kits. It's really, really important that you do so. Okay, I'm going to get off the soapbox here for a moment. What I do also want to do this morning is go through the HPM Shop, because there's a couple things I'd like to show you guys this morning. All right, so I'm going to pull up my screen here. And here we go. So on HPM Shop 22, the first thing that you should know is that we can sell for both 21 and 22. How you'll know the difference? First, in the URL, it should say 2022. And then also our logo is slightly different. You'll see HPM Shop 22. So that's how you know you're in 22. Go ahead and log in. The first thing I want to cover is active selling permissions. Many of you are saying, hey, the plan's not on here. I can't see the plan. What's going on? And you want to make sure that you have active writing permissions on HPM Shop. So how do we do that? How do we check which carriers are ready to go? You're going to go up to the top right corner. You're going to find your name. You're going to click the down button there, and you're going to go to Account Overview. So you're going to click Account Overview, and you'll know you're in the right place when you see your own face. All right. So there's your picture there, your copy link. So everyone has a personal URL. So you can copy your link there. I recommend that you save it, keep it on your phone. You can text it to your clients. You can email it. And, December 7th at 10 o'clock at night, this link is going to become super important. So just make sure that you know that link is there. All your personal information is down there, but this is what I'm after. So you scroll all the way to the bottom here, and you can see which plans that you are ready to sell. These are your active selling permissions. They're loaded. If you have any doubt about the plans, please reach out to us. Jonathan has been working diligently to get these loaded. So this is a great place to check your active selling permissions, okay? So that's how you get to that. The other thing I do want to go through is I'm getting text messages and calls about, hey, I can't see the D-SNP plans and I can't see the C-SNP plans. And so I'm going to run through a really quick demo here. So I'm loading up the plans here. Let's say you start a profile, however you do it. You start a profile, you go through it, and now you're at the plans page. This is the page that you're going to go shopping on, right? The first link is this blue link here right above where all the plans show up, and it says Add Special Needs Plans. You must click this button in order to add the special needs plans. It's not going to automatically show the D-SNPs and C-SNPs, and that is on purpose, okay? They don't want somebody that does not qualify for a D-SNP or C-SNP plan to see those D-SNP or C-SNP plans. You have to manually add them in. So this is how you do it. You click Add All Special Needs Plans, and instantaneously it's going to add all those D-SNP and C-SNP plans, okay? So that's the trick there. Just pay attention to that. There's also another way to add in the D-SNP and C-SNP plans, and that's when you start a new profile. So when you're starting a new profile, you're going to go to, if you're in Add Preferences there, one of the very first questions is which type of plan do I want? So Medicare, medical and prescription drug coverage, and do I have extra help? And if you answer yes, I receive extra help, that should automatically add those D-SNP plans, okay? The other part of that is when you get all the way down to other preferences, and it's going to ask you a few additional questions. Okay. So the page 1 is, are you interested in hearing, vision, dental, a Part B give back? That's new for this year. So we say none of these for now. We go to continue. And this is where your C-SNPs live. So if a person has diabetes, that's how the system is going to know to add the C-SNPs as well. Okay. So best practice, take your time, build out the profile for your client. And when you get to the page, you should see the plans that they qualify for, including the C-SNPs and the D-SNPs. Okay. So really important. Take the time to do that. If you just jump to the other plans, it's fine. Just know that that blue button is there. And so you can see, how to hide the plans and add the plans back in. All right. Another feature that went live on Friday is the add non-licensed plans. So when you click this button, it should show right under the amount of plans in which zip code at the very top. And there's a new button there and it says add non-licensed plan. What is this? When you click that button, it's going to show you the plans that you do not have active permissions to sell on HPM Shop. And that could be because you didn't certify for that plan this year, or it could be because you didn't send us the RTS yet, you haven't loaded it yet. So just know that these are plans that are not showing on HPM Shop, okay? If you see one that you're certified with on HPM Shop and it's not there in your active selling, please reach out to us. We'll gladly fix that, okay? What will happen, though, is it will not allow you to sell that product, okay, on HPM Shop. It will not allow you to send out a quote. So, you want to make sure that all of the plans that you're aligned with us are showing here, and so you have it all in one place, okay? So that's it on HPM Shop. Just please make sure that you're using it. I know many of you have started using it last week. There are some speed bumps in this thing. It's not perfect. It's a brand new version for 2022. We are aware of a couple of issues. The first one being WellCare, having to send out the application to the member to enroll. We are working on that to complete that. Hopefully this week, hopefully that will be resolved. And we've sent everything up to Connecture, and HPM Shop should have WellCare with the same abilities as every other plan. So you'll be able to complete the application and get it out to your member. So that's one thing that we are aware of. The other one is provider search. We understand that some carriers' provider searches are not 100% accurate or are not loading. If you see an issue, don't be afraid to let us know. We may already know about it and are working on it, or at least let them know, the health plan, that their provider search is not working. But just in case, just let us know, shoot us a message, and we're glad to work on getting that fixed. So we appreciate the feedback. All right, I'm going to talk about book of business really quick. I just want to remind everyone, those of you that have been reporting your sales, you have access to your book of business at any time. Just send us a message and we will email you back a secured copy of your book of business. So if you have not already called all of your clients, or you want a copy of that, you want to do a mailer, whatever it is, we are happy to send that to you. So that way you have it and you can go ahead and, connect with your members. That's your book of business. We only keep it to help you organize it and get it into the CRM system. But that's your CRM system. We just build it so you stay organized and effective. So if you would like to make a request, just let a team member know and we'll go ahead and get that book of business out to you. One reason why you want to be checking your book of business right now is that I'm hearing a lot from you guys that, hey, I didn't realize it, but my members disenrolled, or they got called from a health plan and they switched them, or they got called by a call center, or they bumped into somebody and I didn't know about it because, that just happens. Last week, one of my clients from a while ago called me because, every year they call, and they had called a commercial on TV last year, and they're not on the books. And so that happens more often than not. But if you're not checking in with your members, if you're not building that relationship, if you haven't talked to them in a while, then sometimes they don't know that you do all the plans, or they forget, or they see a really sexy TV commercial with all this stuff for free, and they call, and as soon as they call, they're linked into a call center, and bye-bye client, okay? But this is why we want to build a relationship. And also, just remember, it's not your client's job to remember you. It's not their job. It is your job to remind them that you're out there to help them, okay? So don't take your eye off the ball. I know many of you are working with new clients, getting them on the books, but don't forget about your existing clients, because that is your salary, right? That is your residual commission that's coming in. Okay. Last thing here is I did send out a kickoff video last week in regards to 22, the selling season for 22 for Medicare. And it gives you a big snapshot on what's going on out there, where we're at. But most importantly, the contests are listed in there. And if you've been working with us for a while, you know that we're always excited about our contests for this year. And so I'm not going to spoil the contest, but I do want to remind everyone that kickoff video is on YouTube. It's also in your email. It's also, I believe we texted as well. It is a little lengthy. It's about an hour long, but you can watch it in chunks if you prefer to do it that way. I believe I also put that one in chapters as well, so you can jump to the contest if you prefer just to know about the contest. It's in there as well. And we just want to make sure that everybody's up to date on those focus carriers. And we talk about that in the video as well. So with that, I'm right at time. Did good today, lots to cover. I do appreciate everyone being on the call today. And if you have any suggestions, if you have any ideas for the Monday call, if you want to hear about a certain topic, or you need an update on something, I'm happy to help with that. And again, just know that we are recording these calls. So if you do miss one, don't feel bad. We will have these recorded and we'll send them out to you. And they'll be on YouTube as well. So if you want to take time, jump over to YouTube, subscribe to the channel. So that way, if you miss one, at least you'll get notified that you can go ahead and get ready to go on watching that video. So with that, I will bid everyone adieu. Thank you very much for being on the call. Be safe out there and good luck.